Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Moodcongruent and incongruent features of bipolar disorder. People with bipolar disorder may experience moodcongruent or moodincongruent symptoms of psychosis. Moodcongruent means that symptoms such as hallucinations are aligned with a person's mood state, manic or depressive. Moodincongruent means symptoms and mood state are not aligned. /r/n/r/n symptoms that are moodcongruent or moodincongruent can impact how a person manages their bipolar disorder. /r/n/r/n Read more to learn about psychosis in bipolar disorder, including moodcongruent and incongruent features. /r/n/r/nPonyWang. Getty Imagesrnrn Approximately half of people living with bipolar disorder will experience psychotic symptoms. Psychosis is defined by a loss of touch with reality. It is a symptom of psychotic disorders and can be present in mood and other psychiatric disorders. /r/n/r/n Individuals with bipolar disorder can have psychotic symptoms such as hallucinations, delusions, or disorganized thoughts and speech during a bout of mania, a heightened, elevated mood, or depression. /r/n/r/n Symptoms associated with psychosis in bipolar disorder include /r/n/r/n Difficulty functioning at work, school, and home is a qualifier for whether the other symptoms meet the criteria for a disorder. /r/n/r/n Symptoms of mania include periods of elevated mood, an inflated sense of self, and grandiose thoughts. Depression can consist of prolonged sadness, withdrawal, or lack of pleasure in activities. Mood-congruent psychotic symptoms are delusions or hallucinations that are in alignment with the person's mood. /r/n/r/n Moodcongruence and incongruence are associated with learning, memory, and the speed of information processing. /r/n/r/n Research indicates that people with bipolar disorder, during a depressive or manic episode, have a bias in their attention based on their mood. In other words, a person who is manic is more likely to pay attention to a face with a euphoric expression than one with a sad demeanor. /r/n/r/n There is also research supporting individuals processing content more quickly and prioritizing content that aligns with their mood state. /r/n/r/n When psychotic symptoms are moodcongruent, the content of a person's delusions or hallucinations aligns with the person's mood state. /r/n/r/n There is often a grandiose or inflated sense of self-esteem with mania, while depressive episodes can involve sadness, powerlessness, guilt, shame, and other difficult emotions. /r/n/r/n During a manic episode, examples of mood-congruent psychotic features could include a person believing they have superpowers or are best friends with a celebrity. Conversely, beliefs of having committed some unforgivable crime or hearing voices criticizing them can present during depression. /r/n/r/n With a moodincongruent symptoms, the content of a person's delusions or hallucinations does not match their mood. For instance, a person may believe they are being targeted, persecuted, or controlled during a depressive episode. /r/n/r/n Moodincongruent features may be associated with a poorer prognosis and response to treatment, so it's essential to monitor symptoms and share information with medical and mental health providers to support the best outcomes for stabilization and treatment. /r/n/r/n Psychotic symptoms can occur with bipolar disorder and schizophrenia. However, one of the differences between these conditions is that bipolar disorder is a mood disorder and schizophrenia is a psychotic disorder. /r/n/r/n The main features of bipolar disorder are mood episodes characterized by mania, hypomania, or depression. Meanwhile, delusions, hallucinations, and disorganized thoughts and speech are key features of schizophrenia. /r/n/r/n research indicates psychotic symptoms in bipolar disorder as being more typically mood congruent and lasting for shorter periods when compared to presentation in individuals with schizophrenia. /r/n/r/n medication is always recommended for treating bipolar disorder, and therapy may also be recommended. Treatment can help people manage shifts in mood or psychotic symptoms that can accompany bipolar disorder. /r/n/r/n key goals in treatment may vary from patient to patient but often include psychoeducation, stabilization of mood, reduction in psychotic symptoms, if present, safety planning, and developing coping skills. /r/n/r/n mood stabilizers and antipsychotics may be prescribed to treat bipolar disorder symptoms. /r/n/r/n adherence to medication can help get symptoms to a manageable level for patients and aid in periods of recovery. /r/n/r/n talk therapy, as an addition to medication, not in place of medication, can be effective in treating people with bipolar disorder. Therapy creates an opportunity for patients to /r/n/r/n forms of therapy utilized in the treatment of bipolar disorder may include cognitive behavior therapy, family-focused therapy, interpersonal and social rhythm therapy, and techniques from dialectical behavior therapy. /r/n/r/n witnessing a loved one's struggle with symptoms of bipolar disorder can be challenging and worrisome, but there are things you can do to be there for them. /r/n/r/n if you or someone you know are having suicidal thoughts, dial 988 to contact the 988 Suicide and Crisis Lifeline and connect with a trained counselor. If you or a loved one is in immediate danger, call 911. /r/n/r/n Moodcongruence or incongruence relates to symptoms of psychosis that either align or conflict with a person's mood. Psychotic symptoms can influence a person's ability to function in daily life. /r/n/r/n treatment including talk therapy and medication is available to help people with bipolar disorder manage these symptoms. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.